So in today's video, we're going to talk about the RDL, okay, how to transition into that when you have low back problems, and also just kind of how to program it into your overall fitness or training routine. Before we go into that, I'm going to show you a testimonial from one of my clients I fixed with knee and also low back pain.
My knee on and off for like 20 years now, and my lower back about 2.5 years since my pregnancy. I mean, for the knee, I had surgery probably 10 years ago. Didn't do anything. And PT, and then just working with different trainers and stuff. And then the last like 2.5 years, it would be okay. My lower back, I'd work out, tried yoga, it would be good. And then like 2 months later, I'd hurt it again and I'd be sidelined for another 6 to 8 weeks. And it's just this ongoing cycle of either blowing my back out or hurting my knee. It's like night and day. The knee pain is pretty much non-existent. Things that would trigger it before don't trigger it now. And my back pain, it's just, before it would, like, I would feel it and like stop me in my tracks. And now it's just like subtly there, but not, it doesn't amount to anything. And then it goes away. And it's like, I can do normal things and not feel it.
So this is my wife here. She also had a lot of low back problems. And again, to fix, just like you saw in that last testimonial, to fix the low back, you first have to fix the glutes. You have to create a support structure in the glute medius and minimus. If you don't have that, then all the pressure is going to go on the low back. So you first have to develop that so that when you go into doing low back, then the pressure will be off. I don't even focus on low back at all until the glutes are fixed. Now, with her, after we fix her glutes, the other major problem is, and again, that other client you saw in the testimonial didn't have any abdominal issues. It was mainly glute issues. But with my wife, she had extreme lordosis. So her butt would stick out like this. And it was mainly because her core wasn't strong enough so it wouldn't pull under. And I've talked about in other videos that if the glutes are weak, especially the internal rotation of the glutes, mainly the glute minimus, that also has a factor. But with her, genetically, it was more about her abs. So we're going to show you real quick an ab test that she needed to pass in order to get fixed. She's really strong right now in her core. So put your hands behind your head and just do the legs out test. Okay. So if she can flatten her back, stay 6 inches off the floor, right there. Can you keep your back flat? Now she can keep her back flat and go 6 inches off the ground. Even this, she's starting to fade here. Okay, but when she started, she could not keep her back flat on the ground, even to here. But now it's super strong. If we go down a little bit lower and fight, this for her, now she's flat, okay, but go down lower. Now I can get my hand underneath. So she still has work to do in order to pass this test here. And you want to be able to do this with 5 pounds and be able to keep your back completely flat on the ground. This is 5 pounds. I could be here and I'm pretty flat, okay? Hard to get my hand under. So that's kind of the goal. But again, you got to start where you can really keep it flat. So when she started here, that's where she could keep it flat. And then you start working your way down. That's a good initial test. Some of my athletes that, are squatting or RDLing, in the 225 for an RDL or, 350 for a squat, they need to be able to do 8 or 10 pounds with their core. That's how I know their core is going to hold up with those exercises. So that's a simple test. And now let's go into the RDL. Generally, if we're going to do just a squat, shoulder width, I like pairing that for bodybuilding, and I call it athletic bodybuilding because we're trying to build muscle mass and athleticism at the same time. Sports training, that's more for performance-based. They both kind of cross into each other. It's very similar. But as far as if someone's doing a regular squat here with the box, without a box, and it's a little bit wider base, that's very similar to doing a sumo deadlift. So I like pairing a squat, like you saw, with just a regular barbell RDL, and I focus on the hamstrings and the posterior chain and the low back. If someone's sumo deadlifting, I'm doing a cycle with sumo deadlift, I'm going to pair that with a front squat because that's going to be, you're not going to be able to do as much weight, and it's going to be very quad dominant. So that's kind of how I set the system up, and I change the cycle like every month. Very simple. So now let's just work on the form with the barbell RDL. This is going to be her first set. Again, I call it a connection set. She's trying to just focus on her hamstrings and her low back, really focusing on the form. It's not going to be super heavy, and she's going to stay around that 10 to 12 reps, just get a nice warm up, and then we're going to do one all-out set, close to failure when we're dealing with lunges. When we're dealing with squats, you can go a little bit more to failure. When you're working the back, I like challenging the athlete, but maybe keep like 2 reps in reserve. So that's, sometimes it's a little cautious, especially when you have to do with that. And as far as low back injuries go, make sure you keep in mind, like before I have someone do an RDL, they need to pass all my hip tests in my app. Like they got to get all that stuff down. They got to get their glutes to another level. The glutes is a support structure for the low back. If the glutes aren't where they need to be, you will hurt your back when you start trying to build it up. So she's been through the system. She has all that, and she has no problems, correct?
Yes.
All right, so let's RDL. As far as width goes, okay, you want to be around the ankles right on the outside of your hips. If you get a little bit wider than that, that's okay, but around there, if you get too wide, you're gonna have a tendency to collapse your knees in. So that's why, like here, I'm gonna push the knees out a little bit. Again, you wanna feel like your weight's in your heels. You wanna really sit back on this. She's gonna keep her weight back, and she's gonna pull with her hamstrings on the way up. Pull, settle down, and pull with the hamstrings. Feel the hamstrings stretch on the way down. A little bit less knee bend. You got your knee bend, and push your feet a little closer together. That's what I want. Put your feet closer together. Okay, go ahead. And pull with the hamstrings and with the glute. Yep. And I like to, yep, good. And just a little bit below the knees. Feel the stretch on the hamstring, and then pull up with the hamstrings. Feel the stretch, and then pull up, squeeze the glute. Pull from the hamstring and the glutes. That's what I'm constantly telling my athletes all the time. Pull from the hamstrings and the glutes. Yep, good. You can go a little lower. Let your head go down. Okay, and up. That's a nice one. I like that right there. That's a good depth. Yeah, like that. Okay, rest. You're done. Now, if she had 45s on, she had the bigger weights on here, then I just have her touch the floor. Sometimes if you're dealing with someone who's got range of motion issues and they come down and you see their back like this, where it's like hunched, they can't keep it, then I will raise it up a little bit higher and just have them touch to that position there so they don't end up in that right there. So a lot of the times that's just hamstring flexibility, and you just try to stretch your hamstrings and you can get rid of that. So that's our connection set. Now we're going to try to train very close to failure. Again, with RDLs, you got to watch it on the back. You can train very close to failure, but you got to watch how hard you go. So I would say that's pretty easy. I think that connection set, I think she could have handled probably a 10 and a 5 on each side. So I'm going to go with, she's pretty strong on this. I think she could handle 95 pounds on this. This is going to be very challenging for her. Now, if this is too hard and it's too much pressure on her back, which it might be, I'm just going to have her do 5 reps. And her goal would be 8 reps on this, close to failure. Down. Yep. Up. 1. Squeeze. Pull from the hamstring. Feel the hamstring stretch, then pull. Go a little lower. Pull from the hamstrings and up. Yep. Good. Stretch. Now pull from the hamstrings. Good. 5. 6. Okay, rest. Good. So did your grip give out?
I felt like I'm getting weak.
Why are you talking to the camera?
I felt like I'm getting weak, so I didn't want to push it too hard because I knew I can do better quality after the break.
Perfect. So now we're going to go give her about a 2-3 minute rest break. She's been training for probably over a year like this now, right? Right. So she's pretty adapted to training to failure. So she understands her body pretty well. It takes you know, when you start, we're just doing just nice sets of 3 by 8 to 10, 10 to 12, just building a foundation for 3 or 4 months, making sure that all our small muscles are intact so they're not going to get injured. And then we start training to failure. If the athlete can't train to failure, then you're going to have to do at least 2 sets close to failure in order to get results, because you got to push the body. So that's why with this, she stopped shy. She could probably do 3 or 4 more reps like that if she really had to. So I'm going to have to do another set in order to create that stimulus. Not just for growth, but just for overall strength. 1. Yep, squeeze. 2. Good. 3. Good. Pull from the hamstrings. Yep. Pull from the hamstrings. Yep. Come on, 3 more. Come on.
That's it.
Good. How many was that? Like 9?
I think like 7. I didn't.
So again, she wasn't used to that weight load.
I was losing it.
So, but look, she got more reps that set. Now she's adapted. So that's something to keep in mind. So she's probably going to need 2 warm-up sets before she goes into her failure. So what I'm going to do with this is 95 pounds. I'm going to say that the set before this, I would be using 85 pounds for 10 to get yourself. And you could just do a set before that if you wanted to with the bar, or maybe 65 pounds, something along those lines. Just real light, warm it up. Then so you want to use about 85 pounds for your connection set. That's what I would say.
Yeah, and like the first, when you start, you want to feel it, you want to do it right. So, and then it's heavy, right? So you're kind of fighting that. But
exactly. Right. That's the first time you've ever done that heavy of a weight load. Okay, that's good for today.